So why don't we talk now about some of the pieces? Like when we're looking at someone with gut issues, what are the pieces we're trying to lay out on the table in front of us to gather enough information to find what's truly going on, and then of course how to fix it?
100%. So the first thing that I think is essential is you got to do a good history. You have to understand how everything unwound, right? And so when you look at most people's history, a lot of times there's poor diet, there's usually some stress issues, a lot of inflammation compounded by junky fats, poor digestion in general, not being able to break down proteins and fats, lots of refined sugar, usually processed grains, excess omega 6 or trans fats. And these things just continue to put the body in a pro inflammatory state. And what that means is when you become overall inflamed at a higher level, your body starts to break down faster than it can heal. And so the goal of being anti inflammatory, right, is restricting a lot of the foods that drive inflammation so your body can heal faster than you break down. So there's always this net buildup versus net breakdown. And so when you're breaking down over time, what starts to happen is just as, from a joint standpoint, you're starting to feel a little bit inflamed, stiff. From a mood standpoint, you may have anxiety, depression, obviously fatigue starting to creep in because the more inflamed you are, your body's having to deal and allocate adrenal resources to deal with the inflammation, to deal with the stress, where normally those adrenal resources would help with energy and good mood and good circadian rhythm. And so, of course, then that starts putting stress on the thyroid. Then you start having mood issues, cold temperature, hair loss. And then, of course, the more stressed you are, the more that starts to suppress your body's ability to digest optimally. So HCl levels, enzyme levels, maybe bile salt levels start dropping. You start to have a harder time breaking down protein, breaking down fat. You may start getting more burpy or gassy or more flatulence. Now your motility starts to go south, typically more on the constipated side, but you can still have more diarrhea too. And then your absorption starts to go south. And when that starts to go south, now you start to have a bottleneck in all the nutrients, whether it's B vitamins, fat soluble vitamins like A, D, E, K, whether it's minerals or amino acids to help your brain chemicals or cholesterol to help your hormones. Those building blocks start dropping, and then those pathways start getting shorted, and they don't have the resources to run optimally. And when we don't have the resources, more symptoms start to happen. And of course, this kind of compounding this whole journey is the immune system starts to drop. And then when the immune system starts to get weaker, now bugs can start coming into the situation, whether it's parasites or yeast overgrowth or SIBO or bacterial overgrowth or H. pylori. And again, we don't have to be married to which one or which system is the one, right? But we have to look at things objectively. And I think it was Dr. Kalish said this to me over a decade ago. It's kind of a good line. He said, patients have the right to have more than one issue, more than one infection, more than one hormonal imbalance going on at the same time. So don't get married to one thing because you have the right to have lots of things going on.
Yeah, yeah. And you illustrated beautifully just the constellation of symptoms that can happen. So if someone is coming in with gut symptoms, that's usually the tip of the iceberg. Underneath that iceberg, just like your poster you got right there. If we put the tip of the iceberg is gut, under the water there, it could be the anxiety, the depression, the fatigue, the low sex drive, the cold hands, the cold feet, the brain fog, the concentration issues, the memory problems, the skin issues. And so once you do a good history, you're also talking about pharmaceuticals too. What kind of like proton pump inhibitors were you on? That's a big thing. Like, were you on acid blocking medications? Were you on other things disrupting your gut? So, of course, figuring out if you're still on those medications, you're not fully going to get better if you have a ton of drugs that are causing these side effects.